My name is Catherine Lunness. I'm Head of Patient Safety at York Teaching Hospital's NHS Foundation Trust. I qualified in 2002 from the University of Sheffield, so that's coming up to 13 years now. Currently I'm Head of Patient Safety, which means that I'm leading on a number of projects to improve the patient experience and improve patient safety in the hospital. We have 2 sites, so we also have Scarborough Hospital and a number of community hospitals as well. My area of expertise is critical care, and I've got a background in education, and I've been leading a big piece of work recently around managing deteriorating patients in ward areas. So we've done a big piece of work in implementing the National Early Warning Score and an electronic observation system alongside a big education programme for nursing staff and medical teams to help them and support them looking after critically ill patients on the wards. When I initially joined the Reservists in 2002, that was when the Iraq War was starting, and a number of my colleagues were deployed. But at that time I was quite a newly qualified nurse. I didn't have a great deal of experience, so I actually didn't deploy for the first time until 2007. And I did 2 operational tours to Afghanistan as a critical care nurse in 2007 and 2010. On the second occasion I was a team leader on the intensive care, looking after a team of 10 staff and managing the intensive care unit on a day-to-day basis. The facilities were fantastic. The first tour that I did, we were in a fully tented field hospital. But we didn't want for anything. You know, you still had a CT scanner, you still had most of the equipment that I was familiar with using here in an NHS hospital. The second time round, because the war had been going on for some time, there was actually, the hospital was based within a building, so the facilities were even better. And I think at that point there were 2 or 3 CT scanners which reflected the workload really. But certainly it didn't feel like we were ever short of any disposables or equipment when we were there. One big difference is that all care is fully consultant-led, so you don't really have the tiers of junior doctors that you have in the NHS. So systems work very efficiently and decisions are made very quickly, and it feels like you're working at the cutting edge really. And certainly I was based at Camp Bastion, which is, most people know where that was now. It was known as the best trauma hospital in the world for the most of the time that it was there, and it was great to be part of that. And I obviously got a range of clinical experiences that it's unlikely that I would have got working in a country like England because of the nature of injuries and illnesses that patients came in with really. I think that one of the areas that I'm most proud of is the care that we provided to local people in Afghanistan, a level and a standard of care that still isn't available to them. And whilst we obviously looked after a number of local people who had got caught up in the conflict, for example with gunshot wounds or involved in some of the bombs and things like that. We also looked after, families who'd been involved in car accidents because they don't wear seat belts. We looked after a number of children who suffered very severe burns, and had we not been there to provide that care, those children would almost certainly have died of infections from those wounds. So that's an area of really good humanitarian work that I feel, in spite of the conflict, that we were obviously able to provide a good level of care and get those children home. One kind of night that stands out in my mind, which I guess explains how tightly you work together as a team, because of my experience as both a critical care nurse and a nurse in the emergency department. I went forward to the emergency department to receive casualties, and was in a trauma bay with a patient who had suffered significant injuries. I was able to work with the team to resuscitate that patient and then continue with that patient into theatre, where I supported the anaesthetist continuing to resuscitate that patient, and then I received that patient into critical care, where I looked after them for the next 5 hours and then packaged them up and kind of dispatched them back to the UK. So in terms of continuity of care, it doesn't get much better than that. You know, if you think of the number of members of a team you come across in the NHS, actually we had one team looking after a casualty as they came through the hospital, and you know, no need for handovers. I knew exactly what had happened to that patient as they came through the doors of the hospital, and I'm the one who handed them over to the aircrew to take them home. So that was really, really satisfying. It was challenging. I think the environment was challenging. So if you imagine working in 40 degrees heat, being in resus with a lead apron on, because you've obviously patients having x-rays, so you need to protect yourself. You've got your gloves, your latex gloves on, you've got your apron on. So physically it was quite demanding, and I think that you needed to go out there fit and healthy in order to work sometimes very long hours. Certainly, having been a nurse, you know, for 8-9 years before I deployed, meant that my clinical skills were at the top of the game. I was very fortunate to work at Jimmy's in Leeds. I worked on a liver transplant unit there on intensive care, and I looked after some extremely sick patients, and I think that having done that for 5 years gave me the confidence to look after a group of patients in Afghanistan, the nature of which injuries I'd never seen before, and the level of cardiovascular instability, you know, some of us hadn't experienced prior to going. I think that some of it does come down to your own personal values, your rationale for, you know, leaving home and going to work in that environment for 4 months. And I think you really rely on your friends. And what was great, I guess, coming from a reservist background is I deployed with a group of people that I'd known for a long time. So I had great colleagues and friends alongside me who'd known me for years, and I think we were able to provide good moral support to one another. I suppose when you're there, your focus is work, and that's different to being a civilian nurse, because, you know, there's days when we want to get off on time because we're going out, or, you know, you've got plans, or you want to go to the gym, whereas actually, you know, some days in Afghanistan could run into an 18-hour day, but I guess you didn't have anything much else pressing, so you just got on with it, and that was your focus whilst you were there. It was always a good day when kind of the aircrew came and delivered us doughnuts that they'd picked up at Kandahar airport. I had great fun learning to play volleyball. We had a sand court there. I can picture one night where we had a race night, and I made this fabulous big hat out of cardboard and bin bags. Obviously no drinking, but you know, there was kind of good times had, yeah, in amongst the seriousness of it all. I think that I've been very lucky in the jobs that I've had, both in critical care and the emergency department. I think that going to Afghanistan on 2 occasions has certainly given me different opportunities, and I would recommend that to other nurses. I'm recently got married and made a decision that at that point I was going to leave the reserves to move on to the next chapter of my life, really, but I'll always look back with fondness on the experiences that I've had, and I think that they add to the type of nurse that I am today. I would say you need to be fairly resilient to enter into the reserves, and fairly robust, but I think that you'll be welcomed with open arms and would have some fantastic experience.